So thank you for now, and now it's my pleasure to announce the last presentation by Brenda King on the Bioactive Beta-Glucan in clinical practice, case reviews and proposed treatment plans. Please, Brenda.
Good afternoon. I have to stand to the side, I'm not tall enough. There you go. I'm going to talk about the case studies of using beta-glucan in clinical practice, and there is a conflict of interest. I've been funded to actually come and speak and also to do some of the evaluation. We've heard quite a lot about different wound types and this idea that we have wounds that stall in the healing process. And you'd think if we get the diagnosis right and we get the right treatment for whatever that diagnosis is, then wounds should heal. But clearly that's not happening. We know that there is an increasing number of wounds out there, and we know certainly in England that 60 to 70% of wounds are being managed in community, and we know that that's part of quite a wide range of jobs that the community nurse has. And whether we have got the skills to recognise clearly when a wound is going wrong in that healing process, and I think that is some of the challenges that we face. Understanding why that acute wound may become chronic, and when we look at this in particular, there are clear reasons why that acute wound on the back of somebody's leg will become a slow to heal or non-healing wound, because we need to treat other underlying problems. So there are times when we need to recognise that if we don't treat differently, it will become stalled. But we also know that it doesn't matter what kind of wound it is, that we may well see the wounds that start to become prolonged. So we see surgical wounds, and surgical wounds that are months. The image, the top right-hand side is a 6-month non-healing abdominal wound. The pilonidal wound below it, and again, a wound that's gone on for months with non-healing. And what we need to sort of think is how and at what point can we recognise that that wound is not progressing, and do we have the skills there, or do we need other ways to actually think, well, this wound is now becoming more of a chronic problem or more of a delayed wound healing. We heard about inflammation, and inflammation is essential for wound repair, but often the wounds that we see display this abnormal chronic inflammation. This is actually a non-healing donor site, and it's 18 months old. It's quite an old image, and I like to think that we don't see anything like that. But once that wound gets into that chronic cycle of events, or that chronic inflammation, then we need to be thinking about what can we do differently to actually get that wound back on track. The bioactive beta-glucan, there is evidence out there about its ability to reactivate some of these stalled wounds, and there has been previous studies and also previous evaluations. What I wanted to just feed back was on the UK evaluations that took place last year. And the Woolgan gel is in a type of hydrogel, so it has all the benefits of a hydrogel, providing the moist environment. It actually soothes and it is quite comforting from a pain perspective, which was something that, the pain scores did improve significantly in the patients that were evaluated. And it's also got this soluble beta-glucan in there that has been demonstrated to stimulate angiogenesis, to enhance cell proliferation, and also increase the ability of wound contraction. Started with a focus group to get a group of senior clinicians to discuss what problems they had in their particular areas with regards to stalled wounds. So there were TVNs and podiatrists in that group, and they then went on to actually do some evaluations. And it was a 12-week evaluation period on wounds that had been non-healing at 4 weeks, or so was showing no signs of healing. 26 patients met the criteria for inclusion into that evaluation process. And in the 12-week period, 27% healed, 30% of the wounds reduced by 50% in size. 5 wounds demonstrated some moderate improvement, 6 did not respond at all. Following the 12-week evaluation, we looked at the wound healing or any further progression, and a further 3 wounds healed after that 12-week evaluation period. We had a few more male subjects, the mean age of 71, but there's quite a wide range. We've got a young person in there at 27 and then somebody at 93. The majority were leg ulcers and of mixed etiology. We also had 4 diabetic foot ulcers, 1 pressure ulcer, and all had been receiving what would be seen to be standard care: compression therapy for the venous ulcers, offloading for the diabetic foot ulcers, and also for the pressure damage. The wound age varied between 4 weeks and in excess of 52 weeks, but over 80% were 16 weeks or longer non-healing wounds. And of the wounds that healed, the leg ulcer with mixed etiology with a 32-week age at start of treatment healed at week 8. Ischemic diabetic foot ulcer, 4 weeks duration, healed at 12. Surgical lower leg ulcer of 16 weeks healed at 6 weeks. Pre-tibial laceration, and these were in compression therapy prior to treating with the Woulgan. A dorsum foot, diabetic foot ulcer, 5 weeks, healed at 2. A 4-foot amputation, quite a long-standing wound of 312 weeks, which healed at 9 weeks. And then a leg ulcer of 14 weeks that healed at 7. This is the pre-tibial laceration. Week 0, it had been static for 12 weeks, and then at week 4, and then healed at week 8. The surgical incision, it was a post-orthopedic surgical wound, over 16 weeks in duration of the wound, but it had been static in healing for some time, and that healed at 6 weeks. The diabetic 4-foot amputation, and this is the wound that had been around for quite a number of weeks, healed at 9 weeks. The diabetic foot wound healed at 2 weeks. So we saw some really, really interesting things and some, significant improvement on some of the wounds. It was interesting to listen to some of the clinicians' comments. There was a comment in one of the clinics, I think they named it Wonder Gel at one bit. But comments like never healed over a number of years, an expectation prior to trying the product was that it wouldn't heal, the wound wouldn't heal, or they thought the healing might be slow, but felt that Woulgan had actually improved that healing rate. Unsure whether the gel would make a difference, never healed in 6 years post-amputation. So quite a few, interesting comments from that. And then thinking about, proposed treatment plan, and I suppose if you think that we need the skills of people who are doing that as an everyday job to be able to recognise when wound healing is going wrong or when wound healing is stalled, perhaps we need to be looking at the duration of the wound as a marker for when we might intervene, rather than getting people to recognise changes in the wound bed or changes in the appearance of the wound. And if it's suggested that wounds with a less than 40% reduction in size at week 4 and they are already receiving standard care are considered to be stalled, perhaps we should be thinking about active treatment at that 4-week time period. Woulgan can be used for up to 8 weeks or as long as the wound is actually healing, and can typically twice a week. Some of the ones that were in the evaluation were just treated weekly. But then obviously if there's no improvement with that Woulgan, then to discontinue. I think we're likely to see more wounds. We've got an increase in elderly population, we've got a more comorbid population, we've got the potential for more wounds become installed. We've got to think about how clinicians recognise promptly when a wound is failing to heal and how we can activate some alternative management to try and support that wound repair. Certainly we saw some very interesting outcomes with the evaluation, and it did demonstrate some potential to boost wound repair and to sort of increase that speed of wound healing. Thank you.